objective for Module 1, which is to craft clinical questions. So I want to pause here and take a break. And we usually take a 10-minute break, and it looks like it is 5:51, so let's be back at 1 minute after 6. So I'm going to stop the recording right now, and when we resume at 6:01, if I don't start the recording, someone please remind me.
This conference will now be recorded.
Okay, well, let's hope everyone's back. We are to the last Module 1 objective, craft clinical questions using the correct PICO format. Before we go, before I continue, how many people have experience writing PICO questions? If you want to just type that in the chat, that would be good. So how many of you have actually had experience writing PICO questions? Prior to the previous semester, we left that as an option for students for their grad project proposal. We did not require them to write PICO questions. Consequently, last semester is the first semester that I really started studying how they were written and understanding how they relate to evidence hierarchies and classifying evidence. It looks like everybody's got a little bit of experience. I have to admit that after reading the article by Gallagher, Ford, and Melnick, I think I need some remediation on writing them because either that or there's some conflicting information in the textbook versus that article. Let's see, okay. All right, so moving on. Okay, so your PICO question, I know this is stated in your textbook and in that article by Gallagher, Ford, and Melnick, but PICO question is the search strategy, or it determines the search strategy. And then the process is that the search strategy leads to an efficient, productive search, and then that search leads to the evidence. And then with that evidence, you can answer your PICO question, make practice recommendations, and actually do evidence-based practice. Okay. So these are some tips of writing good PICO questions that I identified in the article by Gallagher, Ford, and Melnick. You want to avoid wordiness, which involves eliminating unnecessary words. And you also want the PICO question to be structured to find the evidence that answers it, not to support the specific change you've already decided that you want to implement in practice. I know one of the problems over the years that I've encountered in working with students as they designed evidence-based practice project proposals is that they, in their clinical practice or in their reading of professional journals, they've come across a new intervention or treatment or a new process that they want to implement, and they sort of want to use that as their project, which is sort of backwards, or it's sort of like the tail wagging the dog instead of the dog wagging the tail. What you want to start with is a clinical problem. Okay, so you have to have a problem that needs a solution. You can't start with a solution and then look for a problem to fit it to. So that's one of the important things that you should be doing right now is if it's likely that you would be designing your MSN project proposal for the setting where you're working currently, then be looking around for problems in that setting and work from that problem, not from an intervention or a practice change, because the idea is that you want to find what works to resolve that problem. Don't start with a solution and then try to find a problem to fit it to, because that may not be a problem in your practice setting. So you're looking for the best solution to a practice problem, not just the evidence to support one specific solution. Okay. Also, you should write your PICO question in past tense and omit any directional terms like decreased or mitigated. And I know that I'm guilty of this, is including these directional terms. And then something to consider is that some of the elements of a PICO question might not be applicable, or they might be detrimental to your search strategy, like the time component or the T component. If you try including that in there in your PICO question, then it's gonna narrow your search or completely confound your search so that you won't find anything. So you don't need to include that. Another element that may, depending on your practice problem, that you may not know is a comparison condition, or you may not know a specific intervention even. Your question might be, what interventions are there to reduce catheter-associated urinary tract infections in the skilled care unit, something like that. And that's CAUTI is a widely studied subject, and so I'm sure that there are intervention bundles out there to prevent CAUTI, but I just threw that up there as an example really quick. Okay, so the textbook authors, they provide you with templates for writing PICO questions, and there's a different template for each type of PICO question. This is the template for the intervention PICO question, and I would say that if, the vast majority of you are going to have an intervention PICO question, because you're going to find a problem in your practice setting that needs a solution or an intervention. And so probably I would say the intervention PICO questions are going to be among the most viable type of PICO questions for a graduate project proposal. I would highly discourage you from a meaning PICO question, which is going to be the last template that I show. Okay, so this is a template for the intervention PICO question with an example there provided by the textbook authors. And then we have the prognosis template. Okay, an example there in firemen, how does protective gear plus a showering protocol post response to a fire compared to protective gear alone influence or predict diagnosis of cancer over 5 years? One of my students last semester was interested in the problem of occupational exposure to dusts and chemicals and substances in livestock, large-scale livestock farms. And so her PICO question was similar to this, because there is some information out there about the health effects of working in industrial livestock farms. Mainly it's allergies and things that result from inhaling the dust and things that are floating around, animal dander, inhaling chemicals off of, or aerosols that come off of sewage and those sorts of things. But she had a very interesting PICO question, but we were really not sure if it was going to be viable to work with for a graduate project, because what would you do? What practice change could you make to address that problem of industrial livestock barn exposure to chemicals and substances? Okay, now this is the diagnosis PICO template. Good example there in patients with hip joint trauma is a CT scan compared to MRI more accurate in diagnosing a fractured hip. And then the etiology template are women diagnosed with breast cancer who have an onco-type diagnosis score greater than 18, compared to those without an onco diagnosis score greater than 18, at less risk for reoccurrence of breast cancer the first 5 years post-diagnosis. Very detailed question, but I'm not sure, as far as an etiology question, I'm not sure how much distance you could get from it with the grad project. And here's the meaning template. Meaning PICO questions tend to be answered by qualitative evidence. And then they give you an example related to oncology here. You can probably, think of other populations of patients and come up with similar examples of meaning PICO questions. Okay, this is a very important chart. It appears in chapter 2 of your textbook on page 46. And what you're seeing here is the different types of PICO questions on the left column and the evidence hierarchy that relates to the type of evidence that you need to answer those questions. And this is something we're going to get into more as we move on into the next modules, but there are different evidence hierarchies for different types of PICO questions. And for example, in chapter 1, they provided an example of an evidence hierarchy, and it happened to be the 7-level hierarchy for an intervention PICO question. Now, as it turns out, this hierarchy of evidence also applies to diagnostic or diagnosis PICO questions. So basically what the chart is saying here is that intervention or diagnosis or diagnostic PICO questions can be answered by levels of evidence in this 7-level hierarchy. Okay. Whereas the other types of PICO questions have fewer levels of evidence in their hierarchy. So, for example, prognosis and prediction, and etiology PICO questions are answered with this 5-level evidence hierarchy. And you can see that randomized controlled trials and systematic reviews of randomized controlled trials have dropped out of this evidence hierarchy. That's because RCTs, or randomized controlled trials, are typically used to test an intervention. And so it makes sense that they would be used to answer an intervention PICO question, or you could also use them to test a diagnostic test for its accuracy. Whereas that's not the case when you're doing prognosis or etiology PICO questions. And then another different level of evidence hierarchy for the meaning PICO questions. And it's comprised primarily of qualitative evidence, or the highest level of evidence is provided by qualitative studies, but you can also have some descriptive studies in there as well, descriptive quantitative studies. And then expert opinion is a common type of evidence throughout all the hierarchies. Okay, so this is going to be really important going forward, because when you get into, once you've searched for and found evidence, you need to classify it according to its level. Okay, and whether or not your PICO question is an intervention, diagnostic, prognostic, etiologic, or meaning question is going to dictate the evidence hierarchy that you should refer to when you're classifying that evidence. Okay, and that is actually the last slide in the presentation. These are the references cited in the presentation. And so we're going to be done really quick tonight, almost just barely over an hour. So at this time, I will answer any questions about the course, about the content for Module 1, whatever. And if you have no questions, you're free to leave, and I'll continue recording while you're asking questions, because students who aren't in attendance may benefit by the answers to the questions. So, anybody have questions? Or you're too overwhelmed to have any questions? Oh, here's a question. In our citations for discussion posts, would you like page numbers in the citation? Only if you're quoting. Okay. According to APA style, okay, so a page number is referred to as a locator in a citation. Okay, in APA, you can include a page number with a citation of paraphrased information, but it's only required if it's a quotation. Does that make sense?
Yes.
See if we've got any other questions in here. These are the answers to my EVP question, it looks like. Okay. Any other questions? Yeah, so it's not wrong to include a locator or a page number with citation of paraphrased information. However, I'll warn you, if you include a locator, your instructor might think you're quoting, and so it might cause a little confusion there. For me, I would go to the source text and verify that you paraphrased or quoted correctly. And I'll just warn you too, that's one of the most common reasons in my experience for students to have an academic integrity concern come up, is because they have not sufficiently paraphrased information that they've borrowed from a source. They've used too many of the same words that the source did to express the same idea. And then the other thing is that they actually do use the exact words of the source, but they don't format those words as a quotation, which requires enclosing them in quotation marks and including a locator or a page number. Okay, so I would make sure you consult your APA manual and other resources to make sure you understand how to sufficiently paraphrase, how to quote correctly, and how to correctly format a quotation. And one thing too, I would advise you I included quite a few quotations in this presentation, but I would recommend that in your discussion posts, one quotation, maybe two at the most, is sufficient. I know sometimes it's hard to paraphrase information that you don't fully understand. And so then in those cases, it's easier and probably safer to quote. Just make sure that, when you quote, you have to use the exact words that the source used. If you omit or add any words to the quotation, you have to denote the omissions with ellipses points, and any added words that you might add just to create grammatical flow have to be enclosed in brackets. And all that's described in the APA manual. So, are you guys have you all switched over to the 7th edition, or are you still working from the 6th edition? Because I don't know if you knew this, but this semester, Allen College officially transitioned to the 7th edition. So that's why in the syllabus, I required the 7th edition, but I included a little note there that said, if you currently have the 6th edition, you can probably get by if you use these additional resources that we've put together. Dana Wedeking and I put together a crosswalk comparison, and then there's also a grading key that you can consult that has all kinds of information in it about things that I notice I'm correcting a lot in student papers. In fact, I will show you where that is in the course. I think, where did we put that? So course materials. Okay, so there's a publication. Okay, so yeah, here's the 6th to 7th edition crosswalk, which it's a side-by-side comparison of information in the 6th edition that changed in the 7th edition. And then there's this APA style grading key that I put this together a couple years ago based on an article that was about the 5th edition, I think, of the APA manual, but it's been updated to reflect 7th edition. So you could kind of use it as like a checklist as you're writing a paper to make sure that you aren't making APA mistakes. Those are 2 downloadable documents here that you can have. So that way, if you don't want to invest in the 7th edition, you have the 6th edition, you can probably get by. Although I will tell you, the 7th edition is so much better than the 6th edition. They really spent some time improving it since the 6th edition came out in 2010-ish or so. Let's see. Anything else you want me to look at in the course, or if nobody has any burning questions, we can be done. All right, let's see. It looks like I'm using oh, Mary says she's using a pocket style manual by Hacker. Do you think it's okay? Is it specifically for APA, and how old is it? Hacker's a really good writing resource. Usually she covers MLA, APA, she covers various writing things. If it's specifically for APA, it's probably okay, but I'm guessing unless it just came out, if it's not based on the 7th edition, then you might run into some glitches with some of the changes that have been made. One of the good changes that APA made this time around is that it used to be that, okay, so if you have a source with more than 2 authors, the first time you cited that source, you cited all of the authors, unless there were more than 6, or there were 6 or more, I'm sorry. So any source with 3 to 5 authors, you cited all the authors the first time. Thereafter, you cite only the first author followed by ETAL. Okay, any source with 6 or more authors, from the first time you cited that source, you would cite just the first author followed by ETAL. Well, now it's right off the bat, I think if there's more than a certain number of authors, you use ETAL. So there's never any time that you would have to cite all those authors. Anytime you have just 1 or 2 authors, you have to cite 1 or both authors every time. Obviously, you'd have to cite 1, but if you have 2 authors, you always have to cite both author names. So that's one of the big changes. They made some good changes to the title page too. So like you don't have to have that, you have to have a page number in the document header, but you don't have to have that running head anymore. So you don't have to worry about formatting the title page with the words running head, : followed by the abbreviated title. And then starting on the second page, you exclude the words running head. So that's no longer the case. You know, and this new APA manual, I think it's about, I don't know, I paid less. I got the online version of it because I like to be able to search stuff electronically rather than like using the index and stuff. And I think it was less than $40. And I view it through Vital Source. It's not really coming up here, but here we go. So here's the 7th edition. Whoops, I don't know what I did there. So like the table of contents is over here. You can search, like say I want to search for something about secondary source citation. Whoops. Typing with my broken hand, or my broken wrist, so I'm making mistakes. Okay. Oh, and my index is not working right now for some reason. Sometimes this happens with Vital Source. You'll be in it and the index won't work. Okay, so I'm just gonna go. It still doesn't like it. Must be offline or something, but in any case, it's really easy to go to the index too. And then once you get in the index and you look something up, these are hyperlinked. I think it'll let you skip to them in the book. So for example, if I want to look at how to format a secondary source citation, oh, and now to an APA, instead of 2 spaces after end punctuation, there's just 1. They made a lot of improvements to some really annoying problems. Okay, so secondary sources, I'm going to go to page 63. Now this is just showing there's probably a secondary source citation in there, but so I want to go back to where I was and go to a bigger page. So secondary sources, we're going to go to page 258. Okay. Primary and secondary source gives you a little details about them. Like my rule of thumb is that you should always avoid getting information from a secondary source. You can always tell because they've credited the information to other people, but here it shows how to format the citation if you have to get information from a secondary source. Okay, so basically what this citation is telling you is that you have and are reading the source by Lyon and others. And Lyon stated something that he or she credited to Rabbit. Okay, so you don't have Rabbit, you have Lyon. So you're going to credit Rabbit secondhand through Lyon. So that's what this means here. But anyway, just an example of the conveniences of the online version of the new APA manual. So it might be worth the investment because, like I said, it is so much easier to use. Okay. Oh, it says, just curious, can students use VitalSource? Absolutely. You can, and you can also download a desktop app. Like, mine came off my computer somehow right now, because if you have the desktop app, most of your textbooks that you have on VitalSource can be downloaded to that desktop app so that you don't have to have internet access to read them. Currently, right now, I just haven't gone through the motions of troubleshooting why I lost my desktop app, but otherwise, I could open this APA manual without being on the internet like I am right now. But I pretty much try to get all my books on VitalSource now because it's just so much easier to access them. Like wherever I go, I only have to take my laptop with me. So, but if you go to the VitalSource website, you can actually buy the books through them. In fact, let's look up the APA manual. So, I mean, all you have to do is go to this website. You don't have to be a faculty person to access it. Whoops. Okay, I got everything spelled right there. So now I'm just searching on that. Okay, so you can see you got the old version. Here's the new version. It says $31.99 to $35.99. I don't know why that would be different, but okay. Oh, you can rent it for 1 year, or you can buy it. So for me, like I bought it. So let me see. Okay, so gosh, it's only $36 if you buy it. But then this is the VitalSource version. Whereas if you rent it, it's going to cost $32, and it expires in a year. So I don't know. And it'll probably be another 10 years before they revise it. So that would be a pretty cheap investment over time if you bought the 7th edition. Let's see what else. I heard you about the price. Oh, let's see. Any other questions? Looks like you're all still hanging in here, so that's good. Let's see, what else could I'm trying to think of other things that are problematic for students in this course. I got a list here too. we could go and, looks like everyone knows how to use the discussion board just fine, so that's not a problem. Well, I don't have anything else on my list to cover, so unless you guys have more questions, I think we will call it a night. Oh, here, Mary has asked, whoops, I wish this chat field was easier to see. Okay, we've got, Mary has asked, what you think is the most difficult part of the course for students? I think it is building a search strategy that's efficient. Because I think, you know, the way, and I just know from personal experience that there's just so much to it. It's almost like creating a mathematical equation to build your search strategy. And that's what we get into in the searching for evidence module. And that's why there's one activity that you'll do in that module where you have to meet with a reference librarian, and you go to her. I mean, at that point, hopefully you've got a well-written PICO question, and you go to the reference librarian and get help building your search strategy and advice about which databases you should search. And then, like, one of the assignments is going to be an actual literature search assignment, which is really, it's kind of more like a project than a paper, although you put it together like it's a paper. But you'll actually document all your search terms, and you'll show your search strategy and the results that you got. You'll be doing screenshots of it, but that is key to finding evidence, is to having a good search strategy and being able to reproduce it. Because once you've got a good search strategy developed, then you can rerun it periodically as new literature is published over time, so that you can catch any new sources that come up. But I would, I mean, and students last semester who worked at, some of them worked at University of Iowa hospitals and clinics, and they got excellent help from the Hardin Library there. It's like, apparently those librarians are used to students coming to them with this same sort of assignment. So they got excellent help. So that, I think, you know, once you got that part done, and it is, if you're not used to reading scholarly literature, sometimes it's hard to understand what type of evidence you're working with too. Like, it's hard to classify studies as a randomized controlled trial versus a cohort study versus a quasi-experimental study. So that's a little bit of difficulty too, but you'll get plenty of practice doing that too. But I would have to say that's probably the hardest part, was, although students did well on that assignment, that literature search assignment. That and building the search strategy, and then appraising your sources and classifying them correctly is probably the hardest. And let's see, Carly asked, how specific should the P of the PICO question be? I'm interested in post-ops, and I'm wondering how specific to be. Well, see, there you can, I would say, start really specific, like post-op cardiac surgical patients or whatever you're interested in. But is there a specific problem with these patients that you're interested in, or a specific issue? The thing is if you get really specific with the P part, you can always back off of it. To say you were interested in methods to prevent hypothermia. I'm not not an OR nurse, so, but I did work cardiac surgical intensive care for several years. But say, you know, post-operative hypothermia was a problem, then you could start with a specific population of patients like cardiac surgical patients. And if you didn't find anything, then you could back it off just to post-operative patients in general. Does that make sense? You guys can talk. You don't have to you don't have to type in the chat field if you don't want to. Or if maybe I'm not hearing you. It looks like a lot of you are muted, but you can unmute if you like, if you have other questions. Let's see. Okay, so Mary's leaving. Night, Mary. Thanks for your thoughts. Okay. Oh, blood clots, atelectasis. Okay, so those are the problems. So those are kind of problems that any post-op patient could have, right? So, and you're looking for maybe interventions to prevent that. So I think you'd be okay. I mean, you could, like I say, one thing you might do is see if the incidence of those problems are higher in one population versus another. And then you could go with that population if the incidence of these problems is higher in those. Like, I don't know, it seems like maybe somebody with back surgery or knee surgery might have a greater incidence in some of those things because their mobility is going to be more compromised afterwards, after the surgery. So I don't know, but that would drive that. So that's where you need to know, you have some background questions that you need to answer. You know, what is the incidence of blood clots, atelectasis in post-operative patients? And you wrote ambulation there. Does that mean, are you talking about ambulatory? Oh, ambulation pain. So you don't mean ambulatory surgery, I'm assuming. But yeah, I would think some of these complications would be at the patients in post-op populations that have some mobility compromise after surgery would be at greater risk for some of these complications. And so then you could narrow it to one of those populations if you could find evidence that shows that the problem is greater in that population. Let's see. Oh, okay. Yes, that makes sense. Oh, okay. And Mary turned her. She has kids around. And Mary's gone. Okay. No, I'm not in ambulatory surgery. Something I broke my wrist a couple weeks ago and I had to have it surgically repaired. And man, they put the SCDs on my legs before I went into surgery and everything. And I was, it was only like an hour and a half surgery, but, and then I went home, but it was as if I was having like major surgery. Okay, Carly says, perfect. That's what I was thinking. All right. Any other questions? Looks like we've lost a couple people. Jill says, thanks. You're welcome, Jill. And Carly has no more questions. Yeah, I'm really reliable about answering questions in the questions discussion forum. And so if you do have questions that come up after this, just post them in that forum and I'll get to them usually within 24 hours or less, unless you post it like on Friday afternoon, and then it might be Monday before I get to it. But especially if it's a question that your classmates might have too. I mean, even if it's a question about your specific clinical question or your PICO question, your classmates can usually generalize from my response to that question. All right. We still got Carly, Jill, and Carolyn. All right. If If there are no remaining questions, I'll go ahead and close the meeting. All right, going once, going twice, going 3 times. You guys have a good rest of the week. Bye-bye.